Hello there. I'm happy today that I'm going to be in the labor ward and I'm going to meet mothers who are ready to give birth, and I'm sure by God's grace I'm going to come out a happy student nurse. And today I'm going to show you what we need in the delivery, so that when you are going to meet there and when we are going to come out of there, we are going to come out successful, and we are going to have saved life and to have brought someone into life. And this is the best rotation that I'm going to have, that feeling of bringing life to someone. You're bringing someone, you're coming someone to Kenya. And in preparation, I'm going just to talk about small things that you are going to prepare before we start. I'm going to focus on that stage, labor management. I'm still in preparation. We are going to have informed consent, and remember, informed consent from the mother, it should be shortest as possible, because normally when you don't have active labor or active delivery, it means that it's going to take normally for nanny paras, it's going to be 50 minutes, about 50 minutes, and then for multiparas it's going to be 20 minutes. So consent should be as shortest as possible. Then you are going to have all the equipments prepared: oxytocin, agents, and signs of separation for placenta. And then I'm going to talk about what you need. We are going to have personal protective equipment that is going to protect you as person, and you're going to protect also your client, and you will be coming out happily. You are going to have apron that is going to protect you from the specimen or the blood spots. You are going to have goggles, and that is going to protect your eyes from spots, and you are going to have gloves, sterile and non-sterile. And you are also going to have to prepare your delivery pack. In the delivery pack, what you are going to have is amazing. You're going to maintain strictly aseptic technique in the delivery area, that you are going to feel a scientist when you are coming out. You have done something. You are going to have a receiver of the placenta, gauze balls, you are going to have artery forceps, and you are going to have a umbilical cord scissor, and you are going to have a clamp, which is a plastic. And then you need to be courageous enough and inform the mother in the delivery. Talk to them, ask them, I'm just going to clamp and cut the cord. Just inform them to know what you're doing at that moment. And you're going to apply the plastic disposable clamp close to the navel end of the cord. Just inform the mothers and your assistant that is there. Talk, and for that the mother to forget about the delivery. You're going to place it 3 to 4 centimeters clear of the abdominal wall, to avoid pidging of the skin. And again, the artery forceps is placed closer to the placental end, but near the other clamp, just to make sure that the distance is close. And then you are going to have a cut in between the clamps, and surely you're going to protect others from the blood spot, so you have to cover the cord to shield the other personnel from the blood spots. You have to use a gauze to cover the cord of the. And then you tell the mother, I'm just going to strategically place a drape or a sterile towel under you, so that you inform them before what you do. You inform them about the procedure. I'm just happy that things are just getting lost. You tell them, I'm just going to place my hand gently on your abdomen. You are placing that hand just to make sure that you are palpating, and you're also supporting your brain, your applying some pressure downward. Then you place your non-dominant hand on the fundus. This you are going to apply this non-dominant if you are right-handed. I mean, you're going to place your left hand. Then when you place your non-dominant hand above the cervicis pubis with a thumb like this, then you are going to feel some pressure on the placenta when it delivers. As the placenta comes out, the abdomen rises up and there is that contraction. Grasp the cord with the dominant hand and apply controlled steady downward movement traction. You're going to have attraction while it's exerting pressure on the uterus in an upward motion. So there is that upward motion and there is downward motion. You are going to pull the cord downward motion, but again the abdominal the pressure of the uterus is in upward motion, because the placenta should be going back. Not when the placenta appears at the vulva. When you can see it, then change the direction of the traction from downward to upward. Now you pull your placenta upward. It's just amazing. The membrane should be delivered slowly to avoid tearing, because you don't want to have episiotomy. You want your client to go home well, saying this was a good nurse, this was a good midwifery. Place your placenta in the placenta receiver and not the time. Yeah, and it's just that amazing. Then the next thing, you are going to assess the condition of the woman. Does the woman has conversion? Normal assessment. Palpate the uterus to feel whether it's below the umbilicus, between 18 to 20/40. Assess the amount of blood loss, quantification of blood loss. Remove the soiled pants. Attend to I will perform your hand hygiene and prepare the next assessment, which is examination of the genital tract. And in the genital tract, you have to explain the procedure again to gain informed consent from the mother, perform hand hygiene and apply sterile gloves, and assist her into a recumbent position with the knees bent, ankles together and knees. Ensure the mother is in a what we call in a delivery position, and tell the mother, I'm just going to cleanse the skin down here with some cleaning solution. Then you're going to clean the external genitalia, the labia majora, from the farthest, swab from anterior to posterior downwards to avoid infection. That is our septic technique. Swab again on the right side and then swab to the other side of the left side, just to make sure that you have not given your client infection. Rub as sterile goes, square around your fingers like this. You rub the sterile goes and tell the mother, I'm just going to check here using my fingers, some cotton gauze. This may be uncomfortable, so you are going to place your gauze to check the and separate the labia, the two labia majora, gently. Yeah, it's just amazing, just amazing.